Hi, thank you for your interest in joining us for the Canvas Clutter Holding Project 2012. This project is carried out by Hartford Partnership Program for Aging Education Fellows in University of Pittsburgh to bring awareness, understanding, and insights about hoarding issue in aging population in the community with the help of a local artist's unlimited creativity. Hppa program is a national program working for the excellence of social work and gerontology. This PowerPoint is made to give you a general idea about holding and some stepping stones towards your art piece. Pathological compulsive hoarding is a specific type of behavior that characterized by acquiring and failing to throw a large number of items that would appear to have little or no value to others, for example papers, notes, flyers, newspapers, and clothes, which will cause severe cluttering of the person's home so that it is no longer able to function as a viable living space, and significant distress or impairment of work or social life.
Hi, my name is Mary Broadland, and in the next few slides, I will be talking about the ways professionals grade or label a hoard, as well as what different stages of hoarding may look like. The National Hoarding Scale is comprised of 5 levels or stages of hoarding, 1 being the least severe and 5 being the most severe. Below are audio files describing each level. Click on the audio icon next to each level to hear a brief overview of the qualifications for that level. Thank you for your interest and enjoy. In a Level 1 hoard, all doors and stairways are accessible. Normal household pet activity is normal. 1 to 3 spills or pet accidents are evident. Light evidence of rodents and insects may be apparent. Clutter is not excessive, and normal housekeeping, safe and healthy sanitation, and no odors are usually apparent. In a Level 2 hoard, one exit may be blocked, one major appliance or heating, cooling, or ventilation device may not be working for longer than 6 months. You may see light pet dander in evidence, some pet odor, limited pet care, light to medium evidence of common household rodents or insects, clutter that inhibits the use of more than 2 rooms, unclear functions of the living room or bedroom, slight narrowing of household pathways, limited evidence of housekeeping, tolerable but not pleasant odors, overflowing garbage cans, or moderately soiled food preparation surfaces. Evidence of a Level 3 hoard may include visible clutter outdoors, 2 or more appliances broken or not functioning, light structural damage limited to one part of the home within the last 6 months, pets exceeding the local Humane Society limits by 1 to 3 animals, audible but not visible evidence of rodents, light flea infestation, medium amounts of spider webs inside the house, narrowed hall and stairways, 1 bathroom or bedroom not fully usable, 1 to 2 spills or broken glass, including chemicals, excessive dust, bed linens showing evidence of dirt or long time use, no evidence of recent vacuuming or laundering, unused full or odorous garbage cans. In a Level 4 hoard, the following conditions may be evident. Structural damage to part of the home that's longer than 6 months, mold or mildew on walls or floors, faulty weather protection, hazardous electrical wiring, odor or evidence of sewage backup, pets exceeding the local Humane Society limits by 4 animals, obvious animal waste, 2 to 3 recent accidents, pet has free range with evidence of destructive behavior, excessive spiders and webs, flea infestation, bedroom unusable, excessive combustible and highly flammable packed material in living area or attached garage, rotting food on counters, 1 to 15 aged canned goods, no covers on beds, and no clean dishes. These are some possible conditions of a level 5 hoard. Structural damage obvious in the home, broken walls, no electrical power, no water connection, no sewer system, fire hazards, pets are dangerous to occupants and or guests, rodents evident, mosquitoes or insect infestations, regional critter infestations, kitchen and bathroom are unusable, client is sleeping elsewhere, human defecation, rotting food, and more than 15 aged canned goods with buckled tops and sides. In the next 3 slides, you will see examples of the Clutter Image Rating Scale. The Clutter Image Rating Scale was created by Randy O. Frost, a well-known hoarding specialist. This scale was made to help people visually recognize a hoard. These pictures will hopefully be able to further your understanding of what hoarding may look like. The picture on this slide shows what hoarding may look like in a bedroom, from picture 1 being a normal bedroom to picture 9 being a severe hoarding bedroom. As you can see, clothing, garbage, food, collections, and more may comprise a hoard. This slide shows an example of different stages of hoarding within a living room. Picture 1 being completely without hoarding to picture 9 severe hoarding. Notice how the room becomes less and less usable until it is completely unusable in picture 6. Even after a room isn't usable, a hoard can continue to beyond picture 9, where the hoard touches the ceiling. Lastly, we have a clutter image rating scale for a kitchen. Picture 1 being no hoard to picture 9 being a severe hoard. Did any of the pictures from the clutter image rating scale look familiar? Seeing where you fit in the scale may help when creating your artwork for the Canvassing Clutter project. This slide contains links where more pictures and information are available that may be helpful to reference while creating your project. So feel free to explore and reflect. Next, we'll be talking about current media depiction of hoarding.
Hi everyone, my name is Carol Schuler. I'll be talking about the 7 categories of hoarding. The first category is the effects on the family. Some of these effects include intergenerational, emotional, physical health, relationships, social aspects, and expenses and cleanup from a hoarder. Often it's been reported that family members tend to feel frustrated when family members who hoard items try to control decisions and the overall situation. Also, family members may feel financial stress towards the person who has a hoarding tendency. Relationship studies have shown that female family members report having more strained relationships with the hoarder than did male family members. Another category is the emotional and psychological toll on the individual. Some of these emotional and psychological tolls include embarrassment, shame, guilt, fear. A lot of times hoarding is something that family members try to cover up. They don't want to discuss with their friends or outside family members. It's something that they would like to hide from other people in society. Another psychological toll is anxiety, obsessive compulsive disorder, and depression. These are common diagnoses or mental health histories found in families who have a hoarder or also the hoarder themselves. There's also treatment options for hoarding, which can be expensive. Cognitive behavioral therapy is a common treatment, as well as group therapy and family therapy. A third category of hoarding includes triggers and risk factors. Some of these triggers include sentimental value of objects, access to home shopping network, repetitive buying from eBay, dollar stores, credit card purchases, and of objects that are just usually not used or packaged away in boxes sitting in the home, continue to build up clutter. Another trigger includes the death of a loved one, trauma, either severe illness in early life or during the later years, and also studies have shown a familial history of obsessive compulsive disorder as a possible trigger as well for hoarding. Some societal perspectives that in hoarding include the Great Depression. During this time, people were very poor, not well off financially, and continued to struggle. So just continuing to hold on to items of value over time may have been a reason for hoarding to occur in this generation of people, the baby boomer population. Just the availability of going to the dollar store to purchase items at cheap prices and to continue to build up these items. And before you know it, you have 10 of everything of a certain thing from the dollar store. There's some discussion about historical and cultural factors also, as well as international factors that can affect someone that is a hoarder as well. A fifth category of hoarding includes health and physical toll. There's the stress on the caregiver. You know, a lot of times family members are just unsure of how to help a hoarder and how to get proper assistance from outside sources. There's safety related to falls and fire hazards due to clutter in the home. There's also an issue with sanitation, proper air quality and circulation. And also, a lot of these older adults, you know, have COPD or asthma, and they may even have pet dander or pet issues due to hoarding of animals. A sixth category of hoarding includes monetary costs. Hoarding can be very expensive. A lot of people can go into debt for purchasing items repetitively or items that are just not of use. Insurance coverage can be high as well. Also, help with actually cleaning up a hoarder's home, and psychiatric issues and treatments they may need can actually be expensive as well. And just professional organizations that may come and help and assess a hoarder's home and how to best assist them, it can also be expensive as well. A final category of hoarding that I will discuss are the roots of hoarding. Some of these include sexual abuse, mental abuse, physical abuse, historical occurrences such as the Great Depression discussed earlier, and trauma. Hoarders have reported a significantly greater number of different types of trauma. They have more frequent traumatic experiences, more symptoms of inattention and hyperactivity. There's also a greater comfort level derived from their possessions and possessions in their home. These findings are consistent with previous reports in the literature.
Thank you for your attention. If you have any question or concern, please don't hesitate to shoot us an email at hoarding.pit@gmail.com. Carol and Dana will be more than happy to answer your questions or direct you to the right person who may be helpful to you. Looking forward to hearing from you soon.